this is amazing what you do, and I'm really impressed. I saw your Facebook. You're very famous on your Facebook, and you have so many followers. The main issue you do is pain relief, right?
Yeah, I mean, everybody has a pain, you know?
Well,
yeah.
60% of people in the United States have pain.
If you have certain symptom or illness, pain follows, you know?
Exactly.
Breast cancer, you're going to have a pain. You got any cancer tumor, you're going to have a pain.
Well, one of the principles of inflammation is a pain.
Yeah.
It's edema, color, and etc., etc. Yeah. But pain is the main.
Yeah. So usually, I deal with a lot of sciatica.
Oh.
I'm really good at sciatica.
Really?
Yeah, I'm very good, and I'm very good knee pain. Sciatic and knee, they're connected. You know that. When patient comes to me first, I ask them, "Do you have a knee pain or back pain?" They go, "I have both." Then I ask them, "Do you have a back pain first or knee pain first?" Usually they say back pain first. Then I know right away, sometimes when they have a back pain first, the pain comes from your sciatic nerves on your knee. So when you're trying to heal your knee because of pain, sometimes it doesn't work because pain comes from your back. So you have to touch the back, then I have to touch their knee. As soon as I touch their sciatic nerves, you know, pain disappears. But when people with the arthritis or the bone on bone, then I touch the knee, or I don't even have to touch them. I just look at them or put my hand close by. That's how I heal pain, you know, knee pain and sciatic. But I'm really good at sciatic, you know. I touch their back, then I touch their hips. And
what do you exactly feel? Because, you know, this is more mechanical problems. I mean, the biomechanical problems. For example, sciatica could be a piriformis syndrome, or bulging disc, or a pinching nerve or something.
Nerve, yeah.
But how you know, possibly can make that disappear? How can you resolve this mechanical problem?
Well, well, when I touch, my hand generates heat.
Okay.
So, for sciatic, usually you need heat. You know, usually when people have sciatic pain, what do? They lay down on a lot of people, what they do, they put hot water bag or something in the machine to make pain disappear. It's the same concept, but my energy heals. So usually when I put my hands on that area, L4, L5, where the nerve goes down, I put my hands in there, then they could feel nerve releasing. You know, the sciatic is nerve getting tight. They could feel nerve releasing. They could feel right away. And some people could feel energy is going down to their nerve, going all the way there. That means getting healing. Some people feel pain, some people feel tingling. You know, then I touch their back. But for me, what I feel is just heat in my hand. I don't feel anything else, just heat.
So you have a certain type of energy coming out of your hand.
Yeah.
And you don't differentiate it regardless
well, it's not me doing the healing. It's not my energy. So energy knows what to do. Because one example, a kid came in with high temperature. You know, like 103, really high temperature. And she goes, "Please do something." And this was like first time I'm healing people, you know, like not too much experience. And I said, "Man, my hand generates heat. I don't think if there's more heat, it would be a problem, right?" She goes, "Doesn't matter." She grabbed my hand, put my hand into her son's head, boom, and ice is coming out. Cold heat. Now cold, you know, cool. I go, wow. I could feel cooling coming out. Now I know. Energy knows what to do in a certain situation. You understand that?
Yeah. Well, how about headaches?
Yeah, I do headaches right away.
Migraine?
Right away. You know, I use chakra. You know, chakra to make them disappear. And it's kind of funny. When I touch headaches runs away. Runs away from my energy. You know, yesterday I did this lady on headache. She did a therapy on person to person, but I knew some headache left over. So I called her. She goes, right now I have a little bit headache left over. So over the phone I did this. I was concentrating on the left side, and she goes, "Oh my God, My headache is now my front. So I try to catch it. She goes, my headache is spinning. It's just not standing still because when I put my hand in a certain area, it moves away. So what I done was I put my two hands, imagining putting two hands. So now they cannot run, they cannot run. So she goes, oh no, it's not running. I said, where is it? Your headache is back of your head. She goes, yes. And it's not moving. She goes, yes. So I keep on getting closer, and goes, oh my, it's disappearing. I caught the headache in my hand. And what I done was I go like this and boom. And I watch